This is a technique looking at great toe mobility, mainly the MTP joint, metatarsophalangeal joint. Typically in the clinic, the motion we're trying to restore is extension for normal gait and heel off, push off phase of gait. So what we have is a metatarsal head, which is very, very convex. We have a concave phalanx. So with great toe extension, the bone motion and the glide motion are the same. So as the phalanx comes up dorsally, the glide is also dorsal. So what I'll do to mobilize it is I'm going to stabilize the metatarsal at the joint. I kind of come in with this key grip, usually on the big toe, and I'm just going to bring it to its barrier and then glide it dorsally. Sometimes I add a little bit of traction at the same time, so pull the toe off the metatarsal, go to the barrier, and then glide the same direction as the bone moves. What you have to be careful is if people have bony changes in this area, whether it's bunion bony changes or just dorsal bone growth, like a dorsal exostosis, you don't want to try to mobilize into that, because now you no longer have a concave end of the metatarsal. Lots of patients have some additional bone and they almost have a hood, an overhang, so to speak, here. And if you try to mobilize into that overhang, you're just going to be jamming bone on bone. So make sure they don't have an exostosis up in this area. Sometimes it just looks like it's not a normal bone formation. Be really careful about mobilizing that. Let me show you on a real foot what that looks like. So again, we switched right on the skeleton, left on the model. So I'm going to be on that joint line. So again, most times the skin crease is the joint line. I'm going to give her a broad grip on that metatarsal, so make a metatarsal sandwich. Bring her to the barrier. I like to use this key grip. Here, she's at her barrier of extension. I can add a little bit of longitudinal traction, and then I'm just going to glide it up towards my body. Again, if I get sloppy with it so you can see the direction, that would be a dorsal glide for extension. So go to the barrier. Again, I'm going to give her a nice firm squeeze, a little bit of traction, and then glide it up towards my body. Nice technique.